easier. So I'll be talking on brain-computer interface and its role in rehabilitation and the current status. So basically, particularly brain-computer interface per se is a huge topic, and I mean it is very difficult to cover in such a small short time. But the thing is, I'll try to cover majority of the things, majority of the areas, and especially the current standards and current status of brain-computer interface, and try to give the overview of that. So the brain-computer interface, particularly if we talk about the definition, it is basically the communication between the brain and the external device, or sometimes the spinal cord, particularly if I'll be talking on that later. And basically it captures the brain waves, brain signals, it analyzes it, and it delivers the command to the external device. That is how it works particularly. So coming to the history, basically way back in 1924 when Hans Berger came up with EEG, that discovery formed the foundation for development of brain-computer interface. And although we are talking about brain-computer interface in recent few years, it started way back in 1969, where at UCLA they started developing BCI, and later on Defense Advanced Research Organization in US also, they started working on that in 1970s. So we have reached quite a lot of level, but still there is a lot ground to be covered. So there are various strategies which are used in brain-computer interface, and the primary goal being the improvement in quality of life. So basically, if we consider brain-computer interface, we can divide it in mainly two types, largely broadly. The first one is assistive brain-computer interface. Basically, it is the permanent alternative to whatever disability or whatever neurological dysfunction a patient or person is having. So that is what we were discussing in the earlier talk of Dr. Bala, that whether if there is brain-computer interface, whether exoskeleton is being used, and because of that patient might not get actual benefit on. In fact, there would be some amount of muscle atrophy. That is what we discussed. So that is what is the difference between these two, assistive BCIs and rehabilitative BCIs. So assistive BCI is basically the alternative, and it completely replaces the actual functioning of our body, our muscles. While rehabilitative BCI it includes both the things. Initial part, it might be replacing the function, but later on it assists the function, or in fact it augments the recovery of the neural circuitry. That is how it works. So coming to the concept, basically I will not go into the details, but basically there are four concepts on which the BCI is built. The first one is the neurofeedback mechanism, where the volitional activity is already there, and the BCI helps the patient by doing frequently the volitional activity and simultaneously measuring the brain activity or other central nervous system signals, and it augments whatever function is missing. Another thing is operant conditioning, and it works by reinforcement technique, where there is a feedback. If there is desired action, there is a reward, and there is undesired action, there is a no reward, or the other way around, the other response is being made. By that, the particular function can be improved using brain-computer interface. The third one is by repetitive engagement. Repetitive activities are being done. The BCI-based task-focused training is done, and repetitive recruitment of the circuits which are involved in that particular task are augmented by the BCI. The last one is the Hebbian learning. It is basically dependent on the neuroplasticity, and it works on the level of neuro wired together, and based on that, they strengthen this sensory motor circuitry using the feedback mechanism, the sensory feedback mechanism whenever it is being used. And this is how, by augmenting the neuroplasticity, by enhancing the neuroplasticity, it improves the function, and it helps in neurorehabilitation. Coming to the types of systems, three common types of systems which are being used nowadays. The first is the invasive one, which are directly placed inside the brain. Partially invasive are basically they are attached to the skull or they are above the brain extradurally or intradurally also. If they are there, they are not invading the brain parenchyma particularly. And non-invasive or minimally invasive techniques, minimally invasive BCIs which are available. There is a recent stent which is made, so which is by endovascular technique in the superior sagittal sinus. A stent is placed around the motor cortices on both the sides, and that it functions as a brain-computer interface. I will be coming to that. So what you can see in the upper picture, it is the oldest of these devices is Utah micro array. It is around 4.2 millimeter size with 100 arrays in that, which can be seen, which is placed on the nail in the down image. So there are basically three components in a given brain-computer interface system. First thing is signal acquisition. Second thing is signal processing. And third one is the output device where the command is given to the output devices. This is how the brain-computer interface works. So the utilization of the brain-computer interface in rehabilitation particularly, if you talk about, it is being used, it is being explored for motor recovery, for communication purposes, as well as for cognitive rehabilitation. In all these three areas, it is being widely being studied. So coming to the recent advancements in the brain-computer interface, the first part which we talked about, the signal encoding. So initially the signals which were being encoded, they were coarse signals. There were no fine details which were available, but now there have been developments of high resolution neural decoding devices, which are recently being developed by Stanford University, and they have got 94% accuracy in decoding intended speech. So that is, so if a person is intending to speak, whether that patient has probably, if that patient is having motor aphasia, but still he is trying to speech, he is trying to develop a sentence, he is trying to speak a sentence, but he is not able to speak. But this signals are being recorded by this system, and almost up to 94% of the accuracy is achieved in predicting what he is trying to speak. So that is how is the latest development. It is quite significant amount of development in terms of speech analysis. Another is adaptive learning, machine learning systems, which is being developed by MIT, and we are talking about it quite a lot in these days. So there is continuous training, continuous learning by the system, by the user's feedback. So it continues to learn, it continues to improve over the period of time. There are also wireless systems being developed, as we all know about Neuralink, BlackRock. All these companies have already developed these systems, and these are completely wireless systems, completely inside. They have extended battery life, and because there is no outcome, any external wires or any other system connected to them, the risk of infection is significantly less. So clinical application, these all things we have talked about is actually the technological aspects. But what about the clinical application of this research? So there have been limited studies which are available, limited large studies which are available. But if we talk about significant studies which are impacting the results, which are giving the future directions, one of them is a study done in US. It was a multi-center trial finished in 2023. 200 odd patients were there, and they combined brain-computer interface along with a transcranial direct current stimulation, and they got 65% improvement in upper limb function, which were paretic or paralytic. Similarly, there was quite a buzz about this neurotechnology and new study done by Swiss researchers, and they actually developed it was a brain-computer interface in a way, but on the other way around, it was an interface between the brain and the spine. There was a high cervical spinal cord injury with completely paraplegic patients, and they developed a system where intracranial electrodes were placed, where the signals were decoded, and those signals were transmitted, connected to a spinal cord stimulation, which was already placed there. So it was the communication between the intracranial electrodes and spinal cord electrodes, it communicated, and that system actually made the patient walk. This is a video of that system developed in Switzerland. I'll not go into the details for the sake of time. So other emerging techniques and technologies which we talk about is minimally invasive devices, which I already told you about, that it is a synchron centrode technology, that this stent is placed in the superior sagittal sinus around the motor cortices, and it works as a brain-computer interface. There is also Berkeley innovation in 2022. They ultrasonic neural dust. There's such a small size device which basically works on ultrasonic waves, and it is basically self powered, and it is very small size, and hardly any disruption is there in the neural tissue. So coming to the latest two innovations, one is by BlackRock and another is by Neuralink. So BlackRock has already, it is much ahead of Neuralink particularly if you talk about, but BlackRock has already got its device registered in US FDA as humanitarian device exemption, and this is being used fairly commonly in US particularly. I'll not go into the technical details particularly. Coming to the Neuralink system, many of us might be knowing, we have seen quite a lot of videos and quite a lot of buzz and quite a lot of marketing is being done behind this. All the Neuralink is still in the early stage, but what they have advanced is they have miniaturized the brain-computer interface, and they have made robotic system to place this device, place the electrodes within the brain, and that robotic system has got 10 micron accuracy. That is quite amazing, and it is still in the early phase. Phase 1 is still phase 1 is just complete, and they are going to enter in the phase 2 trial. So there have been other breakthroughs in terms of AI integration with brain-computer interfaces, and Google has started working on that in collaboration with DeepMind. Apart from that, there is Harvard-MIT collaborative study which is also ongoing. They are developing hybrid AI BCI systems, and many more studies are ongoing. So as I already mentioned, in various areas of rehabilitation, motor, cognitive as well as communicative field, the research is ongoing, and in motor aspects, motor recovery or motor rehabilitation, there is quite a lot of progress, but the progress is still far behind as compared to motor progress in cognitive and communicative fields. So in cognitive rehabilitation, there have been deep learning applications which are being developed at UCLA, and for attention deficit patients also, they have tried this hippocampal stimulation, which have given initial good results by 45%. Apart from that, communication systems, as I already talked about, I'll not go into the details because time is already short. And clinical evidence, if we talk, there is hardly large RCTs which have been done. Whatever evidence is available, from there, motor stimulation and motor rehabilitation, we have got around 40 to 50% improvement. And in spinal cord injury, we have already talked about, and I already show the case of Switzerland a study where they developed brain-spine interface. So there have been a lot of technical, clinical, and ethical challenges which are there and which are hindering the pace of progress in the field of brain-computer interface. And what many Hollywood movies have already predicted years ago, it is already a reality in many of the fields and many of the technologies and techniques. And there are a lot of other things which are predicted, which might be seeing soon as a reality, which Hollywood movies have predicted. Probably our Bollywood is also not far behind in the same aspect. So future prospect, if we talk about, there is a lot to work on. And there are many technological advancements, clinical applications, and research directions are there, which we have to still work on and to get benefit for the mankind, particularly if we talk about. And various mobile brain-computer interfaces, virtual reality integration, just like artificial intelligence integration, and multimodal systems, hybrid systems, which already significant amount of research is ongoing. So this is what, to conclude, BCI basically represents a revolutionary approach, but it's still in the development phase. Continuous technological advancement is still ongoing. There's growing evidence, particularly if you talk about the motor rehabilitation for clinical effectiveness, but a lot of work has to be done. And promise of improved accessibility and usability is still to be proven, and there is significant amount of need for further future research and development in this field. Thank you very much.